Okay. So let us start with 3 Om recitations and prayer. Adopt Dhyana Mudra. Focus on your breathing. Breathe in. Ah. 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 Please join your palms. Prayer to Ma Durga. दुर्गै स्मृता हरसि भीतिमशेषजन्तोः स्वस्थैः स्मृता मतिमतीव शुभां ददासि दारिद्र्यदुःखभयहारिणी का त्वदन्या सर्वोपकारकरणाय सदा चित्ता सर्वमङ्गलमाङ्गल्ये शिवे सर्वार्थसाधिके शरण्ये त्र्यम्बके गौरी नारायणी नमोस्तुते. Slowly open your eyes. So today, excretory system and reproductive system, both the systems are small and we will cover it up. Don't worry. So let us start. Yes. Excretory system is also called as urinary system. And not only urine, but there are 3 organs. Actually, we saw respiratory system also works as an excretory function. Then skin also one of the excretory organ, because sweat, through sweat we are the skin is again giving out all the toxins. And third is urinary system or excretory system, major excretory system. In this system, urine is getting formed, and through this urine, some toxic material, waste products, our body is giving out. Now, during the metabolic process, the tissue in the human body produces large amount of carbon dioxide, waste material. That is all toxic material. And the body also produces waste from undigested food, heavy metals, drugs. We eat many times, we eat medicines and whatever material is there which is not good for our body, that is uh, toxic material. So waste and unwanted substance from body is known as excretion. So elimination of waste material is known as excretion. Now, excretory system, functions of excretory system. Primary function, to maintain homeostasis and remove toxic material. So what is homeostasis? That part is remaining, it is there in our syllabus. But in short, homeostasis is to maintain internal environment, internal systemic environment. Each and every system is working in coordination with each other. So to provide proper climate or environment, our body is performing some kind of we can say some kind of procedures are going on in our body, chemical procedures. And so, for example, if we are breathing and if we are not breathing properly, and carbon dioxide is the amount of carbon dioxide in our blood is getting high and high. So at that time, pH of blood becomes acidic. So to balance that, our body system starts working, and then our respiratory center gets activated, and then oxygen intake increases. So our body is maintaining that internal environment to stay healthy, and that is called as homeostasis in short. Then anatomy means, as I had mentioned, skin, lungs, liver, and kidneys are major excretory organs. But in this part, we are going to focus on kidneys and production of urine. Excretory organs, skin, lung, kidney, that we already saw. Now, which are the organs taking part in excretory system or urinary system, we can say? Kidneys are the major organs which kidneys take part in formation of urine. Ureters, urinary bladder, and urethra. We are going to see one by one how it works and how this whole excretion system works in our body. So first we saw kidneys. Here you can see there are two kidneys, pair of kidneys in our body. Two bean-shaped kidneys around 10 to 15 centimeters long are located just below the rib cage. This is the location of kidneys, and it is one on either side of the human spine. Each kidney has over 1 million urine producing units called nephrons. So basic structural and functional unit of kidneys is called as nephrons. And we have kidneys, they has millions, over a millions of tiny nephrons, and they that regulate water concentration and filter the blood. They are filters, tiny filters located inside the kidney called as nephrons. So just keep in mind, basic structural and functional unit of urinary system is nephron. Now, how kidneys are taking part in homeostasis function. The kidney plays an important role in homeostasis. So what it does? Urine production is the major function. Then excretion of waste products such as urea, uric acid through urine. Maintain balance of water levels in the human body by conserving water when levels are low and excreting it when water levels are excessive. So that balance is also carried out by kidneys. Maintain electrolyte balance, especially sodium in relation to water levels. Sodium is very important electrolyte. If sodium is low, then what happens? There is lots of like giddiness, weakness. Person can experience lots of symptoms. So sodium is required, and that balance in relation with water levels, the kidneys are responsible to balance that. Maintain of acid-base balance. The production of acids during metabolic activities poses a threat to the human body by developing acidosis. I hope you are aware about this term. Many times in hospitals, doctors use this developing acidosis when in critical patients. It happens when this homeostasis mechanism is failed, and then it starts happening this acid production during metabolic activities. Lots of chemicals they are getting produced. So this acidosis, increased acid levels. I had already mentioned about carbon dioxide. When carbon dioxide levels are getting increased in your blood, then it is also becoming acidic. The kidney regulates acid levels in the body and prevents acidosis. Kidneys are the only organs capable of eliminating certain metabolic acids like sulfuric and phosphoric acids. Then hemopoietic function. No need to memorize this hemopoietic and all these terminologies. So kidneys stimulate the production of erythrocytes. So we know erythrocytes are red blood cells, and kidneys stimulate that production of erythrocytes by secreting erythropoietin. And erythropoietin is the important stimulating factor for erythropoiesis. So in production of RBCs, kidneys plays major role. So there is a connection, and that's why in kidney failure, the patients they experience lots of symptoms related with this hemoglobin and all that. So uh, kidneys also secrete another factor called thrombopoietin, which stimulates the production of thrombocytes. So what are thrombocytes? Coagulation for blood clotting. Thrombocytes are important. So then again, two major functions like production of erythrocytes, production of thrombocytes, then maintaining acid-base balance, maintaining homeostasis, excreting chemicals like sulfuric acid, phosphoric acids, and uric acid. Endocrine function. Kidneys secrete many hormonal substances such as prostaglandins, hormones. They secrete hormones. And on the top of kidneys, there are two uh, glands located called as adrenal glands, and they secretes very important hormones that we are going to see later on. So endocrine function is also important. Regulating blood pressure. Kidneys play an important role in the long-term regulation of arterial blood pressure by regulating the volume of extracellular fluid, because blood is also fluid connecting tissue. So water balance is also required there. And second mechanism is renin-angiotensin mechanism that need not, it is not important, and we are not going to see that in detail. But still, it is playing important role in maintaining blood pressure. Regulating blood calcium levels. Kidneys play a role in regulating blood calcium levels by activating one important cholecalciferol into vitamin D. So vitamin D we cannot produce or synthesize in our body. We get it from sunlight. So this activation of dihydroxycholecalciferol is required to absorb this vitamin D. So that's how vitamin D is necessary for absorption of calcium from intestine. So it is all linked, and kidney is major role playing factor here, or role playing hormone here. So there are 7 to 8 major functions kidney is carrying out. The kidney is performing. Kidneys are performing. Sorry. Now basic structural and functional unit of kidney is nephrons, small filters located inside kidney. But outline how it looks are excretory or urinary system. So these right and left kidneys, then inferior vena cava, aorta, renal artery, ureter. This is pipe attached to the kidneys, and it is draining urine into urinary bladder. So this is urinary bladder and urethra. So kidneys, ureters, urinary bladder and urethra. Major organs playing role here. And blood circulation towards kidney from inferior vena cava, aorta and renal artery is carrying blood towards kidney, and renal vein, if it is not, no, it is not there, but still renal artery, yeah, it is there. Renal artery and renal vein both are playing major role in urine formation also. So more detail, if we take section of kidney, it looks like this. This outer part is called as renal cortex, and this middle part is called as renal medulla. cortex and medulla. And this is called as renal pelvis where ureter is attached. Funnel shaped renal pelvis where ureter is attached. Now you can see renal vein is entering here, renal artery is entering inside the kidney. Now in this renal medulla and renal cortex, small filters are there. The filters are called as nephrons, and nephrons looks like this. Can you see this structure? This is nephron. There are lots of small parts of nephron. This is one nephron and it looks like this, and millions of nephrons are located in renal cortex and renal medulla. And in 24 hours, 2 liters approximately urine is getting formed. Urine gets formed in human body. In 24 hours, 2 liter. And all these tiny nephrons, they are functional units. So now you can see here, this is the major part of nephron. It is called as glomerulus. Glomerulus. You can see its bowel-like structure is there. This is called as glomerulus. Now, renal artery. You can see here, red color renal artery. Branch of renal artery is entering in this bowl. And here, filters are there inside this Bowman's capsule or glomerulus. The filters, they are filtering blood. 20% of plasma is getting filtered in this portion. And then 80% of blood, renal artery is carrying outside the glomerulus. Or this is, whole structure is called as Bowman's capsule. Bowman's capsule. So from here, renal artery is entering, then plasma is getting filtered and it is entering into this part. It is called as proximal convoluted tubule. No need to memorize these names and everything. I am just explaining mechanism of urine formation. Okay. So here also from renal artery, blood is entering into Bowman's capsule. In glomerulus, their plasma is getting filtered. Filtered material is called as filtrate. Filtrate is entering into proximal convoluted tubule and it is now entering into, it just passing through this canal, and this canal is called as loop of Henle, and here you can see it is surrounded by branches of renal artery and renal vein. Blue and red, you can see here all branches of renal artery and renal vein are covered. Now it travels through this loop of Henle and it comes up, and while coming up in distal convoluted tubule, again some material which is required for our body, it gets reabsorbed in renal veins. Okay, and waste material, it remains there, and then it goes into collecting tubule, this yellow color big collecting tubule. So this is how urine is coming inside collecting tubule, and all material which is required for our body, water and some other substances, salts, they are getting reabsorbed by renal branches of renal artery. And then this collecting tubule, it is taking this urine towards the ureters. So in short, this is how urine is getting formed. Filter or major filter is glomerulus in Bowman's capsule, right? So it is very simple, but it looks very complicated because of this structure. But it's very simple. Blood is entering here, filtering, getting filtered, plasma getting filtered here. Remaining blood is entering into this system, and all these arterioles and venules, they are having net or capillaries, and capillaries are connected with each other, and they are surrounded, they are surrounding this loop of Henle. And I'm not mentioning all these medical terms or because it is again confusing. So just try to understand mechanism, that's it. And then reabsorption of water salts from this blood and tubule in renal vein, and then this urine is getting transferred into collecting tubule, and collecting tubule is connected to ureter. Ureter is this pipe which is connected to the kidney, renal pelvis, and then urine goes through ureter to the bladder, and then through urethra that person passes urine, right? That is the simple mechanism. In short, we will again go through this nephron. Nephron is defined as the structural and functional unit of the kidney. Each kidney consists of 1 to 1.3 million of nephrons. The number of nephrons starts decreasing after about 45 to 50 years of age at the rate of 0.8% to 1% every year. So each nephron is formed by two parts. A blind end is called as renal corpuscle. So no need to memorize that. And again, a tubular portion is called as renal tubule. What we saw, that mechanism, just you need to understand. Then classification, that is I had mentioned here, but afterwards you can read it. It's little bit in medical language. Now, glomerulus, what we saw, is a tuft of capillaries enclosed by Bowman's capsule. It consists of glomerular capillaries interposed between afferent and on one end and efferent. मतलब entering वाले जो capillaries होते हैं उनको afferent बोलते हैं, और Bowman's capsule से बाहर जाने वाले होते हैं उनको efferent बोलते हैं. The Bowman's capsule is a capsular structure which encloses the glomerulus, and it has two layers. So that layers are to explain this filter mechanism, how this filter whole plasma is getting filtered through 2 or 3 layers of Bowman's capsule. There are a total 3 layers, and through 3 layers it goes down in proximal tubule. And this is urine production. The production of urine in the human body is a blood cleansing function. Normally about 1300 ml of blood, that is enters in kidneys, which excretes unwanted substances along with water from the blood as urine. Normal urinary output in an adult human body is 1 to 1.5 liters, or it varies up to 2 liters a day. The production of urine happens in 3 phases that we already discussed. When blood passes through glomerular capillaries, the plasma is filtered into the Bowman's capsule. This process is called as glomerular filtration. The filtrate, liquid that has passed through the filter, forms from Bowman's capsule, passes through the tubular portion of the nephron, during which the filtrate undergoes various changes both in quality and quantity. Many wanted substances like glucose, amino acids, water, and electrolytes are reabsorbed. We already saw they are getting reabsorbed from the tubules. This process is called as tubular reabsorption, and some unwanted substances are secreted into tubule from peritubular blood vessels. This process is called as tubular secretion. Now, after this 3 phases or 3 Undergoing the above three phases, the filtrate becomes urine. So total 20% of plasma is getting filtered, and then this filtrate passing through three phases, and then it becomes urine. This is also not that much important. For your information, I had mentioned all this, but basic concept is clear now, isn't it? What is urinary system, organs taking part in whole procedure, how urine is getting formed, and what is nephron, and in short, structure of and anatomy of nephron. That is clear? And in this slide, you will see in short main functions I had mentioned. This is also sufficient for you. In this slide, whatever information is there, you can just go through this. This is sufficient, right? Now, reproductive system. So, for continuation of species, a reproductive system is important. Gonads or the primary reproductive organs. So, primary reproductive organs are called as gonads, which produce the gametes. So, sperm and ovum are called as gametes, and reproductive organs which are producing sperms and ovum are called as gonads. Okay. A pair of testes, singular testis, produces sperms in males, and a pair of ovaries produces ovum in females. Sperms and ovum are gametes responsible for continuation of species, right? Now, male reproductive system. Male reproductive system, mainly the male reproductive organs are located outside the man's abdominal cavity. Male reproductive system performs the following functions: to produce, sustain, and transport sperms. The male reproductive cells, they transport it to produce and secrete protective fluid, that is called as semen, to discharge sperm within the female reproductive tract for fertilization of egg cells. So how fertilization happens? Sperm enters into female reproductive tract and it unites with ovum, and then fertilization happens. So that is the main function of male reproductive system. Parts of male reproductive system. Penis. It is the male organ used in sexual intercourse. It has three parts: the root attached to the wall of the abdomen, the body or shaft, and the glans or head, which is the cone-shaped part at the end of the penis. The glans is covered with a loose layer of skin called foreskin. Semen, the semen containing sperms. It is a fluid. It contains sperms or reproductive cells, is expelled through the end of the penis when the man reaches sexual climax. So that is the function of semen and penis. Then scrotum. This is the loose pouch-like sac of skin that hangs behind and below the penis. It contains the testicles as well as many nerves and blood cells. So that sac is very delicate structure, and the scrotum acts as a climate control system for the testes. Testes are hanged in that sac. And a climate control is very important for production of sperm and to keep sperms alive actually. So For normal sperm development, the testes must be at a temperature slightly cooler than body temperature. That is very important part, and that's why all this structure is little bit complicated of this scrotum, because testes are hanging there and scrotum is maintaining that temperature also. If temperature rises, then sperm development is becomes very difficult. Then testes, these are oval organs about the size of large olives that lie in the scrotum, secure at either end by the structure called spermatic cord. Testes are attached to spermatic cord. I will show you again that picture. Most men have two testes that are responsible for making testosterone, the primary male sex hormone, and generating sperm. So testosterone, proper production of testosterone is required for generating sperms, healthy sperms. Then urethra. The urethra is the tube that carries urine from the bladder to outside of the body. In men, it has the additional function of expelling semen. So urine and semen comes out with through one tube that is called as urethra. When the penis is erect during sex, the flow of urine is blocked from the urethra, allowing only semen to be ejaculated during orgasm. Then prostate gland. It is also important gland. The prostate gland is a walnut-sized structure that is located below the urinary bladder in front of the rectum. The prostate gland contributes additional fluid during ejaculation. So that fluid is required during ejaculation with semen. Then prostate fluids also help nourish the sperm. The urethra, which carries the ejaculate fluid to be expelled during orgasm, runs through the center of the prostate gland. So we will go through this diagram again. This is scrotum. Then testes are here, and this pipe you can see. Then seminal vesicles, prostate glands. This is urinary bladder. This is urethra. Penis. Inside penis, this is urethra. This is common duct for urine and semen. This is bladder. This is testes. Testes are hanging here in scrotum. And scrotum, you can see it is outside abdominal wall. Abdominal cavity. It is outside. That's why this temperature control is required there. Now, female reproductive system. Female reproductive system is designed to carry out several functions and is more complex than the male reproductive system, because male reproductive system has only 3 or 4 structures which are playing important role. But in females, it is not like that, because of extra work of childbirth and conception and pregnancy, that is and throughout fertile life, menstruation is also there. So little bit complicated structure, because it not only produces the sex cells for potential union with male sperm cells, but also nurtures the developing embryo and fetus for a period of 9 months. The system is designed to transport the oocytes or ovum to the site of fertilization. The process of conception, that is fertilization of an egg by sperm, normally occurs in the fallopian tubes. Sperm travels through all the way to the fallopian tubes. The next step for the fertilized egg is to implant into the walls of the uterus, beginning the initial stages of the pregnancy. When we saw evolution or organization, at that time we saw union of sperm and ovum, and then it becomes one cell, that is zygote. So that zygote needs to get implanted in uterine wall. So first step is union and then implantation. If fertilization and implantation does not take place, the system is designed to menstruate. If does not happens, then menstruation starts. The monthly shedding of the uterine lining, because that lining, purpose of that lining is to for implantation actually, and if it is not happening, then this gets shed. And in addition, the female reproductive system produces female sex hormones that maintain the reproductive cycle. And these hormones, we need to know their functions in detail, because that is important in connection with yogic practices. Major organs in female reproductive system: vagina, uterus. Uterus is divided into cervix and main body, and ovaries. So I will show you. This is vagina. Vagina is connected with external. So this is vagina. You can see this pipe-like structure, and this is uterus. So uterus is divided into body and cervix. Body and cervix. So cervix has two openings in vagina and in uterus. External os and internal os. It is called as external opening and internal opening. And then this body of uterus, here this vacuum is there for fetus growth. And then fallopian tubes, two fallopian tubes on each side, two ovaries attached to uterus, and fallopian tubes are, you can see here, projections are there at the end of fallopian tubes, finger-like projections, and they are covering these ovaries. So whenever ovum gets mature, it gets transported into fallopian tubes, and then it travels, and midway somewhere, if sperm comes and union happens, then pregnancy progresses. Now it is clear how the organs and major organs of female reproductive system. Now menstruation. So function of female reproductive system is production of ovum, then fertilization, then pregnancy and childbirth. That is the major function of female reproductive system. And this phenomena which happens in fertile age, that is called as menstruation or menstrual cycle. What happens during menstrual cycle? Females of reproductive age experience cycles or hormonal activities that repeat at about 1 month intervals. With every cycle, a woman's body prepares for a potential pregnancy, whether or not that is the woman's intention. The term menstruation refers to the periodic shedding of the uterine lining. Menstru means monthly. Monthly shedding of uterine lining. So what happens? In short, this procedure, when first time in puberty, at the age of maybe 10, 12, this first time menstrual bleeding start, this is called as menarche or menarche. So before that, all female reproductive cells or gonads, or not gonads, gametes, they are in premature state. Premature female gametes are called as premature follicles. Those premature follicles are present in female fetus. Number of follicles, premature follicles present in ovaries, around 1 lakh at the time of when that female fetus inside mother's womb. So at that time, around 1 lakh premature follicles are there. When that fetus starts developing, growing, and at the time of birth, the number of premature follicles gets reduced to around 50,000. Then, till the time of puberty, number of follicles remains only 500 in both the ovaries. So that female, right from the start of menarche to menopause, in that time period, has only 500, maybe differs from person to person, but in that range only 500 to 700 premature follicles. So it depends on, it is hereditary actually, number of premature follicles which we are getting from grandmother to mother, mother to uh, that female fetus. So at the time of menarche, only 500 to 700 premature follicles are there in each ovary, in both the ovaries. And then when menstruation starts, what happens? First, in maybe right or left ovary, the premature follicle starts maturation, and it starts transforming into ovum. Then when mature ovum forms, it is getting formed, that phase is called as follicular phase. So in that phase, some hormones, they start working. So we are going to see that also, names of hormones. But the menstrual cycle has 3 stages. So first is follicular stage, when the ovum is getting mature. Then after maturation, second phase is called as ovulation, rupturing the outer wall of that follicle and mature ovum comes out. And then third is luteal or premenstrual stage, when that ovum starts its journey into fallopian tubes. Inside ovary, this luteal phase starts. This phase is called as premenstrual phase. And if conception happens, then different kind of changes starts occurring. And if it doesn't happen, then this shading starts happening, right? So that's how it is little bit complicated, and all this procedure is governed by some important hormones, female hormones. The cycle will stop if the woman gets pregnant, right? And the menstrual cycle is controlled by 4 major hormones, namely FSH, follicle stimulating hormone, luteinizing hormone, estrogen, and progesterone. First 2 hormones, follicle stimulating hormone FSH and luteinizing hormone, are important in first phase and produced by pituitary gland. And estrogen and progesterone are produced by ovaries. So here you can see phases of menstruation. First 4 days, 5 days, 1, 2, 3, 4, 5, menstruation, shedding of this endometrial layer. Then starts follicular phase, maturation of ovum, 6, 7, 8, 9, 10. So how we count? From first day when bleeding starts, right from that day you should count the days if you want to find out your ovulation or perfect date. It is not, it differs from person to person, but sometimes it helps. So this first 5 days, uterine bleeding, days, menstruation. 6th to 10th day is follicular phase. Then 11th to 16th is ovulation time. Ovulation time. So at that time, any day, that ovulation can happen. So if in 11th to 16th or 17th day, conception can happen. This is important time period for those who wants to start family. So 11 to 17, anytime conception can happen if that female's cycle is fixed 28 days cycle or 30 days cycle. It is not irregular, or she is not suffering with PCOD or any other disease. In normal female, this is fixed. And then if conception happens, ये calculation पूरा बदल जाता है आगे का. If it doesn't, then it enters into luteal phase, that is called as premenstrual phase, and then till 28th day, this luteal phase. After ovulation to 28th day, premenstrual phase is there, and then again menstruation starts. That's how this whole menstrual cycle works. Now hormones playing role. In follicular phase, you can see this follicular stimulating hormone is increasing gradually. At the time of ovulation, it drops down little bit, but it is on peak. So at the time of ovulation, from 11th to 17th or 16th day, which hormones are on higher side? Estrogen, follicle stimulating hormone, luteinizing hormone. And which is flat line, that is progesterone. Progesterone has no role till ovulation. But you can see in premenstrual phase or luteal phase, progesterone starts increasing because progesterone is required for continuation of pregnancy. If conception happens, this progesterone levels, they remain as it is, or they start increasing. And if pregnancy is not there, then progesterone drops down. Immediately it drops down. And here you can see luteinizing hormone also. In ovulation period, it is very high. And after ovulation completes, it drops down. Immediately it comes down when luteal phase starts. So luteinizing hormone is not required in luteal phase. Which hormone is there now? Follicle stimulating hormone. In moderate amount, it is there in luteal phase. So at the time of ovulation, all hormones are on peak, all three. Only progesterone is not there because progesterone is not required for that procedure. Progesterone is required for continuation of pregnancy, for implantation of zygote, for creating a proper environment for development of fetus. And which hormone is required for ovulation? Estrogen, luteinizing hormone, and follicle stimulating hormone. Right? So now it is clear in which phase which hormone is working. Okay. So what happens in polycystic ovarian disease? So PCOD. We saw this premature follicles in this follicular phase. They are getting matured. One or two, it starts maturation. But in PCOD, because of lack of these hormones like follicle stimulating hormone, or if pituitary is not sending proper amount of luteinizing and follicular stimulating hormone, and estrogen is not getting produced by ovaries in proper amount, this ovulation or maturation of ovum doesn't happen. Instead of that ovum, only water fluid filled sacs remain there, and day by day, and if ovulation is not happening, ovum does not come out, and this cycle is called as unovulatory cycle. So ovum is not maturating and it is not coming out of follicle, that ovary, and then unovulatory cycle, and only water or fluid filled follicles are remaining inside ovary, and then they get convert into cyst, and this is called as polycystic ovarian disease. And it is because of hormonal disturbances, and hormones are getting produced because of It depends on our nutrition, stress levels, how pituitary function is there. Pituitary is the major gland which is secreting luteinizing and follicle stimulating hormone and sending towards the ovaries. So connection of hypothalamus, pituitary and ovary, their communication is also required for proper production of maturation of ova. And if it is not happening, then this symptom like PCOD or unovulatory cycle or delay in menstruation, maybe gap 2 to 3 months gap in each menstrual cycle, then obesity, metabolic function deprivation, and then lots of lots of symptoms that female starts experiencing, right? In this picture also, in short, the phases of hormone and phases of sexual or menstrual cycle, it is described. Is it clear? Okay. So in yogic practices, we should know about these hormones. At least 4 hormones are important. And we are going to learn more about endocrine system in next sessions. So how pituitary gland is master gland, and it secretes 8 to 10 hormones, and those hormones are required for production of all these remaining endocrine gland and their hormones. It controls. Pituitary gland is controlling gland actually. Now, just a minute. 8. Sorry, my charging was very low and laptop was about to die. Okay. So all 4 hormones, importance of estrogen and progesterone. Estrogen and progesterone are also, estrogen is called as feminine hormone. It is responsible for femininity, and that we are going to again discuss in endocrine system. Right. So if there is any question, you can ask.
Stop the recording, madam.
Yeah.